Hello there, a warm welcome to yet another very interesting edition of Health Matters, a program reaching you from NTA Channel 12 Rio, your dependable station. And this program we try to focus on health issues that will make you stay healthy and fit. My name is Umo Basi Edate, and today we have in the studio a very important personality that's talking about Dr. Mfon Ineme, who is a clinical psychologist with the University of Rio. Welcome to the program, sir.
My pleasure being here again.
Okay, so what are we discussing today? We have a lot of instances where we hear our young people are going into substance abuse. We have the celebrities that are supposed to be like role models, abusing one substance or the other. And so today we are here to talk about this issue that is raising so much concern in our society. Some parents have had children go to school and come back and they discover that they've been abusing some certain substances that are going down with drugs, and then the effect is overwhelming. So Dr. Ineme is going to do justice to this topic. Doctor, substance abuse is a grey monster and it's very scary.
Really.
So tell us, what is substance abuse?
Let's go etymologically a little. The word abuse is made of two words. It's a Latin prefix, ab, up, meaning away, then use. So when we say somebody is abusing, it means using it away from prescription. The word abuse means use away from prescription. But so any drug can be abused. You can use any drug away from prescription. So whenever you use a drug away from prescription, then you're abusing that drug.
Okay.
Now, then there's also the concept we call misuse. But today, let's look at abuse actually. Now, when we talk about drug abuse in this world now, the first thing that comes to our head is the abuse of psychoactive substances. Okay. That's the thing that comes to head. That's the first thing we talk about. So in most cases, when we talk about abuse, we're talking about the use or abuse of psychoactive substances like alcohol, like cannabis, like heroin, like benzodiazepine, like opioids. We have quite a number of them. And interestingly, new substances are coming up that were not there before. Hitherto were not there. In the past 2, 3, 4, 5 years, we've had new substances come up. And then we've got, I think, Gush, they call it, the one that they remove from the marrows of the dead people. They go to cemetery, to remove. That's what we are now saying. Let's provide security at the cemetery. Your young people are now, they go that far to remove the barrels of they remove the bones and look for what to smoke. Some even smoke petrol, put their nose on the tank of generators to smoke and to inhale and so on. So those are the things that some of the things that our children, our people, not children alone, abuse. Incidentally, someone will say, what leads to that? Now, in psychiatric settings, when we have people that come because of substance abuse, one of the questions we like to ask is there a family history of substance abuse in that family? Is there family history? Because sometimes it's also it's like it runs in families, but it may not be purely genetic in this case. It may be a learned behavior. That you wake up, you are born to see your father smoke. So you learn to smoke. Unconsciously you learn. Or you're able to see your elder brother smoke, or your uncle smoke in the compound. Sometimes you learn to smoke with him. Unconsciously you learn to smoke. Another thing is that some people go into substance abuse as a matter of experimentation. Especially the young children, the teenagers. They want to experiment to see what is inside this thing. What is inside. The another issue is the issue of modeling. Some children choose models. Especially in this age of, how do you call it? Age of social media, where our children have so much access to people, to information you want them to see, they don't want them to see. You may be surprised that your child is in the house and just choosing a model. To do what this person does. He discovered that this person does it, he does so well playing football, does so well acting movie because he smokes, because he drinks, because he does injection drugs. So the child also, because he wants to be like his model or her model, may choose to do what this model does. Because sometimes they have knowing the private life of this